and get the 2 minutes brushing done as well. So next question. When do we brush and how often? I think you already asked that. Go in the audience.
What's your name?
Morning and night.
Okay, so young man saying morning and night. Anyone else do anything differently?
Morning and like next to when you sleep.
Very good. So we should be brushing twice a day. So adults, children, brushing twice a day, morning and night. Now, a question I ask often is, do we brush before breakfast or after breakfast? Dr. Shib.
So always brush before breakfast. You don't want to brush immediately after breakfast because all of the things you've eaten, so for example, you've had orange juice with breakfast, you're going to be brushing that acid into the teeth. So try and brush either before breakfast or at least half an hour to 45 minutes after you've eaten anything, okay?
Absolutely. And the main key thing is when you're using your toothpaste, which has got fluoride, we want to make sure that stays on the teeth. So once you brush your teeth, do not rinse out with water. So brush your teeth, do not rinse out with water. If you do rinse out, you're going to wash away the very fluoride that we want to keep on the teeth that will make it healthy as well.
So on that point as well, if you use mouthwashes, try and avoid using the mouthwash after you brush your teeth as well, okay? Because you're going to wash away all of that good fluoride.
And Jake, can you give us a little insight into the noise that you do when people clean their tongue? Who's been in Vrindavan and you hear it in the morning? 4 o'clock in the morning, so Jake, tell us a little bit about that tongue.
So we're quite fortunate as ages. We all grew up having tongue scrapers as normality within sort of our cleaning habits. Yes, you get that retching sound that comes out. But actually, we talk about bacteria on teeth. Bacteria is lining our tongues as well. And it's really, really important that either we can use a conventional tongue scraper, as we've grown up with, or you can even use a toothbrush to brush your teeth. Sometimes toothbrushes have ribbed or rough edges on the other side if you turn them around. But do not neglect your tongue. Tongue health is very, very important. And a clean tongue can actually give a lot of indication of general health as well. So we do advise cleaning tongue.
Just a point is, Ayurvedically it's good to actually tongue scrape before you brush your teeth, because that before all the toxins in your body are still there, so it's good to remove them by literally tongue scraping before you brush your teeth.
Yeah, so what's the order? Come here. Come. Come, Sia, come. Okay, what's the order then? Call it out, everybody. First thing you do is tongue, then teeth. How long? With fluoride toothpaste. And then wash your mouth. Cork it up? No. Leave it on, and then how long do you have to wait for mouthwash? Half an hour. This kid knows everything. He's going to be smart.
Future dentist. Okay, now let's talk about my favourite thing. I know it's your favourite thing. Food. Who likes chili paneer? Pizza? Chips? Everyone's hands are going, I'm actually hungry now. Okay. What we want to do when we're eating, we want to reduce the frequency of sugary foods. So what we're going to do is play a little game, a quick game. I want you to know some foods are good for our teeth, some foods are bad for our teeth. And what we call that is sad tooth, happy tooth. Some food will make our teeth sad, some will make it happy, and I've sort of linked it to the manor as well. We've got Ravana here, who's going to be the sad tooth, and we've got Lord Ram here, who's going to be our happy tooth. So I'm going to shout out some foods, and I want you to go out and go to the audience and find out if it's a happy tooth or a sad tooth. So first things first, let's go for cereal, Special K. Who has cereal? Who has Special K? Happy or sad?
Is it sad too?
Correct. Round of applause. Again, sugary food. Next thing, chocolate.
A sad tooth.
Well done. Another round of applause. Now I'm going to make it more trickier. Cheese. Is cheese happy or sad? Is it good for your teeth or not? Well done. Cheese is good. Happy. Well done. Let's do one more. Chips. Potatoes. Okay. One more. Chewing gum. Who has chewing gum here? I can still be chewing already there. Alright. Chewing gum. Look at her already like dancing away. It's not for children. So chewing gum again is good for you, for the adults only, not for you kids, because it's got something called xylitol. What that does is actually fights the decayed bacteria and can help you. And what it also does, it makes more saliva come in your mouth, which again is the body's fighting mechanism to fight the bugs in the mouth as well. And the whole idea with the food is we want to reduce the frequency of sugar throughout the day. If we're constantly eating sugary snacks, constantly eating chocolates, the mouth stays very acidic. When it's acidic, remember the bad bacteria? They love it. And that's when they start causing holes in your mouth as well. So we've covered this, how often you should go to a dentist. Who has not been to a dentist before? Put your hand up, don't be shy. So everyone's been to, one of you. So as my good friend Kushal said, we've got a number of practices locally here. Those children in the audience, you can see some of our patients here. You can see Lord Ram there in our Harrow practice. We've got Hanuman waiting outside the practice there. We've got Baby Krishna, one of our practices. We've got Vishnu just sitting there getting ready for his checkup. And we've got some in South London as well. And in South London, that's where Ram and I is as well. I don't know why. Us North Londoners, we don't go south, sorry. So we've got a number of practices, a lot of them are NHS. If someone doesn't pay for dental treatment, we can get that organised as well. If you are a resident at the manor here, we do provide free dental service. A lot of you have been asking us about dental implants as well. So Dr. G is one of the leading dental implant surgeons in the UK. And his techniques are quite unique, and it's actually very particular for all of us here today.
So when we started doing the implant work in surgery, because of our background and faith in the manor, we wanted to work with materials that are friendly to our lifestyle, so vegan friendly. A lot of dentistry, if you don't know, will have animal products. So for over 8 years, we've been doing dental surgery, implant surgery using purely animal-free products. So fully synthetic graft materials, no animal, no human. So these are parts of dentistry which are not very commonly known and knowledge is not there, but I've built my practice using these products because of how I found out how the faith is, and I'm having a lot of devotee patients, and a lot of patients I wouldn't accept animal products. So this is something we can offer to devotees, so you can know fully well we work with these treatments with full knowledge, but also we know that there's no animal.
So we've spoken about a lot of the children's dentistry. As we become adults, and Krishna's grown up now, what do you do for adult checkups? A lot of you are saying, I've been to a dentist for years, I haven't got broken teeth, I haven't got pain, why do I need to go? So there's a number of reasons we need to go as dentists to the dentist as well. Number one thing is for oral cancer screening. So those adults in this room, we need to go for oral cancer screening. Unfortunately, our ethnicity is predisposed to it as well. We've got a higher risk of it. So your dentist is not just checking your teeth, they're checking for oral cancer as well. Dr. Shiv, what else are you checking for?
So, as well as that, we're checking for any cavities. Doesn't mean that if you're not in pain, you don't have a cavity. So you need to make sure you're coming to check cavities, your gum health, and just your general oral health and oral hygiene. So even if you're not having problems, it's really important to get your routine 6-monthly annual checkups, alright?
So in summary, our advice is brush twice a day. Those adults who can floss once a day. We're going to advise you use a mouthwash, but at different time to brushing. Cut down the amount of sugar you're having. So have you had a breakfast and dinner, cut down the sugar. Avoid alcohol and avoid smoking, because these are big risk factors for not just your general health, but for oral cancer as well. So not only will you be looking after your health, you'll be also looking after Krishna, and he'll be happy for you as well if you avoid alcohol and smoking as well. So we hope you enjoyed today's talk on dentistry. We're going to be outside taking any questions. We can take some now. A lot of you are asking, about us as well. I mean, Dr. Kushal we know well, but we actually grew up at the manor here. We've been coming since we were little kids. Our network started at the manor here. A lot of our friend circle A lot of the success and what's happened in our career is from the manor. So we're giving back and hoping we can inspire the next generation of clinicians and dentists, and wherever we can give back, that's what we're here to do. So we hope you enjoyed it. Hare Krishna, everyone. Hare Krishna.